Aphasia means absence of speech. People with aphasia can think clearly but have trouble getting messages in and out. Strokes are the highest cause of aphasia and can happen at any age. A stroke reduces the blood supply to the brain because of a blood clot or a leak in a blood vessel. Brain tissue becomes damaged. The left side of your brain controls your right arm and right leg, and language and communication. If the left side of your brain is damaged, you can have problems moving the right side of your body and problems with language. If you have aphasia, you will have difficulty with communication. You know what you want to say, and you can make your own decisions. You do not lose intelligence. Aphasia is different for everyone. You may find it hard to talk. You may leave out words, have difficulty naming things, create new words, mix up sounds and words, confuse words, or say a repeated expression. You may find it hard to understand others, read, write, and use numbers. The symptoms can be mild to severe. You are not alone. There are up to 16,000 New Zealanders currently living with aphasia. Every day, 6 people develop aphasia in New Zealand. We don't know how much or how quickly someone will recover. Everyone is different. Apraxia of speech can often occur alongside aphasia. If you have apraxia of speech, you will have difficulty planning and coordinating the movements to position the correct speech sounds. This affects the rhythm in your speech. When you recognize errors, you will keep trying to correct them. Sometimes the word won't come out the way you want. You may not be able to communicate in the same way as you did before your stroke. Sometimes talking might not change, but life will get a lot better. Here are some communication strategies for you to think about. Patience. Don't give up. Be patient with yourself. Perseverance. If you don't have the word, keep trying. Give a meaning of the word. Draw a picture, write the word, have a notebook with words that you can use. Act out the word. Have photos or pictures to show people what you want to talk about. Aphasia affects you and your family, friends, and people in your community. Aphasia can be very confusing for everyone. Aphasia is a hidden disability, so people will not always know you have a communication difficulty. People can be helpful or unhelpful, depending on how they react and the support they offer. Some people will not know what to do and will need information on how to best communicate with you. Here are some ideas.
Would you like a cup of tea?
Don't have background noise. Relax. Be natural. Don't pretend to understand. Use pen and paper. Write down key words. Draw diagrams or pictures. Say one thing at a time. Slow down speech. Check both of you understand. Ask what helps with understanding. Everyone must be patient because communication is important. Some people just want to leave hospital and get back home, but at home you will come face to face with aphasia. Living with aphasia brings a lot of new challenges. Aphasia can make you feel frustrated, isolated, bored, depressed, angry, anxious, and embarrassed. You may lose confidence. As time passes, aphasia becomes less of a problem. People find ways to cope and learn to live with aphasia. You are not alone. There is a lot of support available for you. For more information for your family and friends, a useful website about aphasia is from Canada. Go to www.aphasia.ca. The New Zealand website also offers information about aphasia and finding support for you. www.aphasia.org.nz. The Aphasia Association of New Zealand aim to empower people with aphasia to participate in their communities and live an ordinary life. When you are back at home, become a friend of aphasia. Ask your friends and family to help you join a support group or be matched with a peer mentor who can give you support and advice. There are other resources available and a newsletter that you can receive. The Stroke Foundation can also provide you with support. Go to www.stroke.org.nz. You can also look at speechtherapy.org.nz for more information on speech-language therapy or to find a speech-language therapist. You can talk to your speech-language therapist about the Volunteer Stroke Scheme, or your family and friends can call on your behalf. The Volunteer Stroke Scheme allows you to meet with a conversation partner and practice your communication. Getting better means different things for different people. People learn to accept, adapt, and understand aphasia and focus on their improvements. They feel more relaxed and calm, laugh more, and have a sense of humour. People begin to do more for independence and enjoyment, and learn to communicate better. They have meaningful relationships, are social, care for and help others, meet new friends. They get involved in activities, try new things, make plans. You can join your local YMCA or gym, try Tai Chi, Zumba, dancing. Don't hesitate to ask for support from the Stroke Foundation or the Aphasia Association for more ideas. It all takes time. For your well-being, it is important to feel positive and think positively. It is also important to visit your doctor, have your blood pressure checked regularly, eat a good diet, exercise regularly, have a healthy weight, take prescribed medicine, don't smoke, don't drink a lot of alcohol. It is possible for a small number of people to have another stroke. A quote from a clinician: "You can live successfully with aphasia. It may mean something different for each individual we work with, but it remains a target worth aiming for."